Have you ever had a patient that you've seen come back to you and say that whatever you did caused them more pain? Or even worse, have you had a patient just cancel on you because they're saying that you caused them more pain? So I'm going to talk about the strategy and what you could do when someone tells you what you did caused them more pain, right? So it's always our fault, and that's okay. So when someone comes to you and they said that, oh my God, what you did caused me more pain, these are some strategies in which you could say, right? So this is a strategy. What are you going to say now, right? When someone comes and they say, oh my God, I have just so much pain from whatever you did. And I'm also going to talk about what you can say before, right? What can you say before? So there's two types of strategies for that, okay? So when someone comes to you and they said, oh my God, whatever you did caused me so much pain, or if they canceled on you, then you get on the phone, you call them back, and this is what you can also say, right? So number one, you're going to apologize. Apologize, right? So that's really key. For the most part, everyone wants to be seen and heard, and the person that's coming to you just wants you to acknowledge that whatever you did hurt them a lot, right? And so one of the first things you want to do is just apologize. I'm so sorry that whatever we did caused you more pain. Say we, all right? Say we, don't say I, because I am not the only person here in this therapy game that we're playing. It's you and me, right? It's us, it's we. I'm so sorry that you have more pain from what we did together. Let me ask you a few questions about what happened so we can make some changes. So we can learn more about what happened so that doesn't keep happening again, right? So ask questions, get more info, right? So let me ask you a few questions based on what you're telling me, because I want to make sure that we make the changes and we find out what happened that caused you so much pain over the last couple of days. Now what's going to happen, I forgot to tell you, the best time to use these strategy, okay, the best time to use this strategy is initial evaluation. First time you're seeing them, they don't know how their body's going to respond. You don't know how they're going to respond. This is what you can do, after at the initial evaluation. Anytime you're progressing in your plan, so let's say we go from gentle to more aggressive range of motion to strengthening to weight bearing. These are some things that you're gonna be able to say before and say after if someone comes into you with a change in their pain. Apologize, ask more questions. So tell me, what we were doing in the therapy clinic the other day, what was really hurting you then? They might say it wasn't the therapy session, but it was what they felt afterwards. Perfect. I'm so glad that we're able to see like it was afterwards, because maybe we did a lot of stuff that very first day, right? So when did you start feeling it? Was it that night or was it the next day, right? So these are just some sample questions in which you can ask to get more information. Where did it hurt? How did it hurt? How sharp was the pain, right? Were you able to keep moving with your exercises? Which movements, which exercises were you able to do? Maybe they overdid it, right? Maybe they had so much pain, they didn't do anything, which then caused them to have more pain, right? So pain is not unnatural, it's just telling us some information of what we're doing. So we want to use that information to our best ability, all right? So 3, apologize is number 1, ask more questions, and then 3 is make changes. Make appropriate changes. So by asking these questions, I'm able to say, reduce your repetitions, or maybe reduce the speed in which you're doing these repetitions, maybe work within a pain-free range versus being too aggressive. Either way, these questions gonna allow you to make some changes in your whether it be because you were too aggressive, you massaged too hard, you pressed too hard, you pressed too long. Like, you can make those changes because you were too aggressive. That's fine. You can make changes to how often they are doing something, because that might be the thing that kind of caused them to be more painful, right? So anywhere based on the questions, you can make changes. Now, that's what you can say now when someone comes in and they're like, oh my God, I have so much pain. So that we don't have to get to this so often, the most important strategy is what you're gonna say before. So what you say before is a pre-frame. It's called a pre-frame. So you're gonna pre-frame what they think, right? So you gotta pre-frame what they think, right? So again, this is something that you would say at the initial evaluation. This is key to saying at the initial evaluation. This is key to saying when you progress them from, I'm gonna go from active range of motion to now we're gonna start doing more passive range of motion. We're gonna get to end range, passive range of motion. We're going to start putting weight through our arms. We're going to start doing weights. We're gonna start doing more heavy weights, you know? So anything where you starting with something that you don't know, right? That's initial evaluation and they don't know. And anytime you start doing more of something, you're going to get ahead of the game. Get ahead, right? Which is pretty much anticipating what's going to happen. You're kind of becoming a little bit like a fortune teller, right? So if it's post-op, what's going to happen? If it's non-surgical, what's most likely going to happen? So I'm going to anticipate, if this is a post-surgical, well, you just had surgery, things are swollen, they're going to be painful, and you know, if you haven't moved in a while, in a few weeks because of your surgery, now that we start moving, you might have more pain. And that's okay, right? That's okay, because we know that this is going to happen. If they're non-surgical, well, there's an imbalance going on in your body, you have a tendonitis, you have a, you know, whatever it is that they're coming to you for, whatever we do today may cause you to have more pain. So what you want to do is, after you anticipate that they're going to have more pain, you're going to provide some solutions. Provide solutions. And that's really important, because if you are telling them, I need you to do these exercises 10 repetitions 3 times a day, and they start doing it like a ton more, right? You have to anticipate their personality. They're either gonna overdo it or they're gonna not do anything, right? So this is what happens when you overdo something and you haven't moved in a really long time. You overdo it, you might end up with a little bit more pain. If I start moving you now and you see how stiff you are, and then you go home and you don't do anything at all, well, what happens is you can become more painful because of how stiff you get, right? Again, anticipation. And this is what you're gonna do if you become too painful. So give them some solutions. Decrease their repetitions, decrease how often they're doing it, decrease how hard they're doing it. Tell them to use ice, you know, to help decrease their pain. Tell them to use some kind of, you know, soothing type of massage, whether it's, you know, if it's post-surgical, I do that a lot for edema, because edema can cause a lot of pain when they're so swollen. So you just got to anticipate their needs and say it. You might think, oh, this is what's going to happen, but if you don't say it, they don't know it, right? And you've got to assume they know nothing because they've never had this before, right? So you want to anticipate. For my non-surgical people, they're so out of balance that sometimes doing something is going to kind of cause them a lot more discomfort. And so you want to make sure that they know that as well and provide solutions, right? It's not that I want them to stop doing something. I might want them to do something, but less aggressive, right? So you're gonna provide solutions for them in terms of what they can do right away that's gonna ease their pain, ease their discomfort, okay? I'll tell them ahead of time that they may have, you know, more pain because I haven't moved in a long time in the specific way that I'm moving them. So they might experience some soreness elsewhere. So that's kind of important too. It really comes down to anticipating, you know, what might be happening. Now, the most important thing to say is when something works, right? When something feels good, that's great. When something doesn't feel so good, when something feels bad, that actually gives us a ton of information to work with, right? That tells me so much about what we can do next. So say that to them, especially with the non-surgical people. You know, when you have more pain in doing something, that actually gives us so much more information, because that's going to tell us exactly what we need to do next, right? And then third, you're going to have them come back to you. Tell them to come back to you. Tell them to come back, right? Set that next date. So you anticipate their problem. I'm going to give you some solutions in terms of, if you feel this way, then do this. Next time you come in, right, when you come back for your next session, when you come back for your second session, whatever, when you come back on Wednesday, make it really definitive. When you come back, I really want to know what has worked and what has not worked, so that we can continue to progress you towards your X goals, right? Whatever your goals are. So if they're non-surgical and they're real post-op, then, you know, the next time you come in, we're gonna really go over again what we did today, since it was our first day. And the first day, you have no idea, but you bombard them with a shit ton of information. So it's okay if you don't remember everything I said. That's why you're coming back next time. And whenever, if you have more pain, I need to know that, so that we can adjust what we're doing, so that we know what works and what doesn't work for you, so that we can keep working towards your goals. You know, you might have to watch this video again to hear what I'm saying, use the words that I'm using, because it's in this pre-frame that's going to limit how many times you have to apologize. It's going to limit how many people cancel and drop off your schedule, because it's really huge, right? In an initial evaluation, you anticipate their potential problems, you're going to provide them with some solutions, and then you're going to tell them when you're going to see them next time, so that you can continue helping them. When people know your name and people want to come back to you, that's when you're going to have a chance to really help them get rid of their pain, get them more active, like really help them reach their potential goals, right? And then if they do come in and they say that you did cause them more pain, I'm so glad you came back and you told me, I'm really sorry that what we did hurt you, so that let me ask you a few more questions about your pain. How was your pain? When was your pain? You know, that type of stuff. And we know that some injuries are just painful. We know that. We would have anticipated that at that last visit. I know that based on your injury, you had surgery, it's so painful. This is what we're going to do to ease that pain, right? What works, what doesn't work, and then make appropriate changes in your treatment. If it's me, if I'm too aggressive, sometimes I'm heavy-handed, then I'm gonna change that, right? I'm gonna change it and go a little gentler. Again, you have to be careful with, you know, going from two ends of the spectrum. You're too heavy-handed to now you're too soft. You have to be right in the middle. You have to learn how to grade your touch and grade your pressure and grade how aggressive you are. But at the end of the day, you're making changes, and you're gonna make changes with them. You and I, we're gonna work together. And when, you know, tell them that it's okay for them to tell you. People at the end of the day, for the most part, they're very nice. They don't want to hurt your feelings. And if you're not asking the right questions, then that might be why you're not making the correct changes, right? So make sure that, you know, you read people's body language. You're looking at their face or eyes, how they're twitching and how they're moving and how they're, you know, bracing against you, because you might be too aggressive, right? They might just not know how to anticipate certain things, right? Some injuries just hurt. Fingers hurt a lot. And so a lot of times I'll do like, well, I'll do something easy and then I'll do something hard, and then I'll do something easy and I'll do something hard, so that it's not totally completely unpleasant in their therapy session. But what makes it pleasant is when they see results, right? What makes it pleasant is when they see the results and it actually alleviates the pain that they came in. Sometimes they have to get a little bit more painful in order to alleviate the pain, but that pain shouldn't sit there. That pain shouldn't stay. And so make sure that you have a strategy of what to say right now when someone comes in. Apologize, ask questions for more answers, and make the appropriate changes. And what you could say beforehand to pre-frame, so that they know you know what you're doing. You're going to anticipate their problems, provide them with specific solutions that they can do in between the sessions when they don't see you. And then don't forget, this is the most important part, to have them anticipate the next session when you're going to help them again. All right? I hope this helps. A strategy and what to say, how to say it with patients who are painful.